In this trial, you plan to recruit 15,000 women. Do we really need that many women to answer this question?
Well, whether we need 15,000 or 1,400, 999 and 15,000, you know, we don't need exactly 15,000, but we need a large number. And the reason we need a large number is because we want to be sure that the answer we're getting is a reliable answer. So, you know, just being silly about it, if we only had 15 women and we gave half of them one treatment and half of them another treatment, and, I don't know, 3 did well in one arm and 2 did well in the other arm, we couldn't really draw any important conclusions about that. So we need big numbers, but how big is dependent on 2 main things. One is how common the primary outcome in the trial is going to be. The primary outcome in the trial is death or hysterectomy. Very, very important. And because they're very important, they don't happen, thankfully, that often. So in this trial, I think we're talking about a rate of about 4% for this combined possible outcome. And to be able to see a difference between tranexamic acid and a placebo in an outcome that's pretty rare, you have to have big numbers. If you had a 4% rate in one arm and a 1% rate in the other arm, you had a really, really, really big difference, you could probably get away with a smaller number. But here we're trying to talk about whether we could detect a moderate effect, an effect of reduction by a quarter, by 25%. And that would be down from 4% to 3%. To be able to detect that difference reliably, we need this sort of number. Now, there's a formula to work it out, but the principle is that if you want to detect a moderate-sized difference with a fairly rare outcome, you need big numbers. 15,000 is about right.
Ian, can you tell me which women would be eligible for this trial?
All adult women who are clinically diagnosed with postpartum hemorrhage following either caesarean section delivery or vaginal delivery are eligible to enter into the TheWomanTrial. The most important thing is that the clinician putting the woman into the trial is uncertain as to the effect of tranexamic acid in that particular patient. If they, for any particular reason, think that tranexamic acid is indicated, they should put that woman in, they should not put that woman in the trial, they should give them tranexamic acid. If they think that tranexamic acid is contraindicated, then they shouldn't put the patient in the trial. But if they're uncertain, and given the existing evidence on the effectiveness of tranexamic acid, I would imagine that many of them will be, then it's appropriate to put those patients into the trial. Now, only adults can go into the trial, so only adult women. So in many countries that's 18, in some countries it's 16. That'll vary according to the country.
On the entry form, you ask about estimated blood loss, but there's no standard way of doing this. So can you give us some guidance about how you would estimate blood loss?
That's a good question, because it's not straightforward estimating blood loss. A small amount of blood can look like a lot, and sometimes large amounts of blood can look much smaller than they really are. So it really depends on the clinician's judgment. It's really important that clinicians use their own judgment to decide, just like they would do in ordinary everyday medical practice, to decide how much they think the patient's lost. That might be based on how much blood they see. It might be based on clinical signs from the patient, symptoms and signs from the patient, things like pulse, pallor, whether the skin's cold, clammy, all those sorts of things. So it's not for the trial to tell clinicians how to use their clinical judgment. They see patients with major blood loss all the time, and it's completely appropriate that they can make their own estimate.
Ian, if I'm a woman who's eligible for the trial, how do I go about including her?
The Woman Trial is a trial that takes place in an emergency situation, so it's really important that if a woman's eligible for the trial and after the appropriate consent procedures have taken place, that she's included in the trial as soon as possible. Now, it's a very straightforward procedure. There will be, in the emergency department or in the obstetric ward, there will be a series of boxes containing the treatment packs. And the responsible clinician should take the lowest numbered treatment pack and use it for that particular patient. So the trial's been designed so it's a very simple process so that it doesn't get in the way of normal clinical practice, because obviously looking after the patient is the priority. So it's a very simple procedure. Take the lowest numbered treatment pack and allocate that to that particular patient.
After delivery, is there a time limit for when women can be included in the trial?
No, not really. The postpartum period has, again, a number of different definitions. And if we're talking about maternal mortality, we're saying that the death has to happen within 6 weeks of delivery. Now, we're not reasonably expecting that a woman who's bleeding 5 weeks after delivery is really going to be part of this trial. This is really in the immediate postpartum period. So after delivery, while they're still recovering, and during that period, that whole postpartum period, they would be eligible for being in the trial. But we're not putting a fixed time. We're not saying within 2 hours of delivery or within 5 hours. We're saying within the postpartum period, so long as they fit the other eligibility criteria, they can be included in the trial.
If a woman is randomised into this trial, should I withhold the normal treatment I would give for postpartum haemorrhage?
That's a really important question, and the answer is a very clear no. The Woman Trial does not get in the way of any normal medical practice. So if you've got a patient with postpartum haemorrhage, she should get all the normal treatments that any woman with postpartum haemorrhage should get. In addition, she's entered into the Woman Trial. So the answer is a very clear no. It shouldn't interfere with any other treatments.